But having done a master's, you will, I'm sure, be well versed in what evidence exists for paediatric treatment. Is there any?
Yeah, there's
incredible evidence. I mean,
yeah, I mean, there's one particularly that always gets overlooked, which was my mentor at ACC, Joyce Miller, who in 2012 did a randomized control trial that was that had the parents were blinded from what was happening with their children, and they had a good sample size, and they came out with a very positive result with chiropractic care with colicky babies. A lot of the time, it kind of gets looked at as an outlier. Then again, we have other work that Joyce has done, which I think was 2019 or 2020, where she did a big data study, and she went out and she said to all of the parents that were coming into the clinic and said, how do you feel, number one, about the kind of treatment you've gotten, and what are the outcomes that you're seeing? Because, and we'll see in that the Sturtle's 2014 systematic review, one of the things they never look at is parental response.
Right.
And the thing is, it's the parent that notices the issue.
Yes.
It's the parent, it's the relationship that needs to be fixed by your treatment to get everything organized. So if you're not looking at how the parent feels about what's happened to their child, you're not looking in the right place. Because you can't say, well, let's say the old definition of colic, let's say 3 hours a day, crying for 3 hours a day. I apply some sort of treatment, whatever that treatment might be, and I get that crying down to 2 hours and 55 minutes. I haven't won anything, I haven't changed anything. All I've done is my definition on my piece of paper, I've been able to tick the box. I've done nothing for the parent. So it's that kind of big data that can't really be done in an RCT kind of way that ends up giving you a lot of good information, but because it sits in another realm, it kind of gets washed.